I can recall back in 2002 when I took my NCLEX in Wisconsin. I was not from Wisconsin, but it was 1 hour drive from Chicago, Illinois, where I came from and where I planned to practice nursing. Why was I in Wisconsin? Because I heard from the grapevine that the NCLEX was a lot easier there than in Chicago. Of course, knowing what I know now, that was a complete false rumor. Going back to that morning I was scheduled to take my NCLEX, I can remember vividly the high level of anxiety I was experiencing, as evidenced by my mild tachycardia, diaphoresis, and GI upset. I knew in the back of my mind I did not do everything I could prepare for the exam. I had spent the last 5 months in Europe completing my community health rotation in the UK and backpacking throughout Spain, Portugal, France, and Italy with my friends. Sure, I had the Saunders review book in my backpack thinking I would read while I was in trains, planes, and buses. That was the intention. I was able to commit to that for like 1 week, but as I traveled through more and more cities, buying more and more souvenirs, my backpack had less and less room. The Saunders book, which is a great reading companion for the NCLEX by the way, became a heavy burden suddenly, if you know what I mean. So unfortunately, it was the first to go to make room for the shoes I had to buy in Spain, of course. This is why I was sweating bullets on the morning of the exam. I had just come back from Europe 2 weeks ago. I had an ICU job waiting at a top medical center who was already orienting me, and I had not studied more than a few hours just memorizing labs and meds. Eek, what was I thinking? To be honest, in those last 2 weeks, I was thinking, I had just spent 4 years at a highly reputable nursing program costing me $100,000. I will just trust in that investment and be confident that if my learning experience didn't arm me with enough knowledge at this point, cramming in those 2 weeks could not save me now. So I turned to prayer and negotiating with God. If He interceded and helped me pass, I would spend my lifetime becoming the best nurse I could be to my patients. I even conversed with God in my head, rehashing what I dedicated myself to during the past 10 years. Helping my mom during my summer vacations at her 3 jobs, planning and executing psychosocial activities for the elderly, at-risk adolescent boys, and developmentally disabled children. I knew I was destined to dedicate my life in this profession as I worked as a CNA and nurse extern throughout my college years. So I should pass, right? I deserve it, right? These are the thoughts that were running in my mind before the exam. So I went right into the testing area, took a deep breath, and started focusing on each question, which were a little bit blurry, maybe from the lack of oxygen. I approached number step 5, the minimum number of questions an RN can receive. It didn't shut off. So my heart started racing, so I closed my eyes and started to pray again. Took some deep breaths, and I started answering again. A few more questions later, 5 to be exact, it shut off. Oh my God, what does that mean? I started to panic. As I drove an hour-long drive home, continuing praying, I hoped for the best. I also tried to reflect on the exam. If I could predict if I passed or not, I had to wait 48 more hours to get my results. 2 days later, 48 hours of little sleep and not telling anyone I took the exam, I called into the result hotline and the first word was, "Congratulations." I hung up the phone and started screaming. I could now tell all my family and friends I would not lose an opportunity to work as a new grad in the ICU, and now I can pay my student loans and credit cards. Phew! That experience was so emotionally draining, and unfortunately we all have to go through it. But hopefully for you, not as nerve-wracking. This is why I'm here today. Number 1, I hope to share with you the information I wish I knew and understood before I approached my NCLEX that it could have saved me some sanity. And number 2, have you be particularly aware of your personal challenges going into the exam and hopefully arming yourself enough to increase your chances of passing. Understand that all of your experiences may be somewhat different from mine and with each other as you approach the exam. In the last 7 years, I have been teaching students and coaching candidates for the NCLEX. I have stumbled upon many roadblocks that students nowadays have to deal with that were not necessarily existing 10 or more years ago during my time. I truly empathize with you, and we at D&D are here to help you in your journey. So let's get started.
From that star up in the sky, from that mountain peak up high, hey, I made it, I'm the world's greatest.